So I'm going to start and just give you a very quick biography for both of our speakers, and then that will be more than enough from me, and I shall hand over to them to get into the content for the evening. So as I mentioned, Dr. Claire Rayner is a retired consultant occupational physician and has worked across several sectors, including transport, manufacturing, healthcare, heavy metals, chemical, electronics, food and pharmaceutical, construction, service and utilities. Claire is an experienced trainer and group facilitator with CIPD and Myers-Briggs type indicator qualifications and has particular expertise and experience as a communication skills trainer. Claire talks to you this evening with first-hand experience of long COVID, and in April 2020 co-founded a large medical team to set up, track, profile and educate the unfolding scenario of long COVID. With these colleagues, she has written several papers on this novel condition, including 3 editorials on returning to work after long COVID and a UK consensus document on its clinical management. We're also going to hear from Professor Neil Greenberg, consultant academic, occupational and forensic psychiatrist based at King's College London. Neil served in the United Kingdom Armed Forces for more than 23 years and has deployed as a psychiatrist and researcher to a number of hostile environments, including Afghanistan and Iraq. At King's, Neil leads on a number of military mental health projects and is a principal investigator within a nationally funded health protection research unit. He also chairs the Royal College of Psychiatrists Special Interest Group in Occupational Psychiatry and is leading the World Psychiatric Association position statement on mental health in the workplace. I think it's fair to say, ladies and gentlemen, that we have 2 experts in the room this evening. And without further ado, I'm going to hand over to the first of those experts, Dr. Claire Rayner.
Oh, thank you very much, Catherine. That's really kind. And I'm very glad to be here tonight. So I'm going to talk today about occupational health and long COVID and the need for early intervention and what we need to do to achieve that, really. Of course, employers are key and I think very much affected or will be affected by this problem in their staff. So hoping that we can work together at strategic level on this. Just a little bit of background about where I'm coming from. I was an occupational physician, although I'm retired now, and also a national health and work trainer. So that was about a decade ago. So I'm used to sort of spreading the messages about good work and occupational health practice. I think back in April 2020, I wrote my first paper about long COVID, because as occupational physicians, we are very much taught to look for patterns in things. You know, it's a very conscious part of our training. So I had by that time developed some quite long duration symptoms after COVID, and along with many others, was picking up some patterns that were very similar between everybody. And as I say, that's very much what we're taught to do. One of the situations we're taught to really look out for new health problems is in the situation of anything new. So we might say a new process in a factory, we might say a new substance in use, or a new combination of factors. So I think COVID brings all that with it. I went into occupational health because I was drawn to prevention and community health. And so for me, I'm all about prevention and early intervention. It's always cheaper in every way. And I also think it comes down to the management of risk, be that financial, business, safety or health. So what's occupational health about? In broad, it's about 3 things. One is the prevention of occupational diseases, and we call that the effect of work on health. Second is about the effect of health on work. And so in the context of long COVID, this is very much about supporting individuals back into the workplace and thinking about adjustments. And the third big category of activities that we're involved in is risk management. And with this, we try to understand and advise both the employer and the individual, and really take a balanced look at things. And I think that's what a good occupational health professional should do, is take a very balanced look at the employer's needs and the individual workers' needs. So very much we aim to work with senior management, because without your buy-in, we can't really achieve anything significant or lasting. Catherine's mentioned the scale of the problem of long COVID, and I think it's quite horrific, the latest figures of 2 million. Now that comes out of the people that are reported to have long COVID are mainly of working age. And so the working population of the UK is roughly 31 million. So we're talking 2 million currently affected out of 31. That's a huge proportion of our workforce affected. And those are the ones we know about. The impact, I guess, goes without saying, and I'm sure that all of you will have experienced this in one form or another. As an employer, you're going to have people with very significant long-term sickness absence if you haven't already. So we're finding that, you know, many of those 2 million, in fact, the majority have been off work for the 2 years or unable to work to their normal capacity. So this combination of duration, the impact on daily activities, and the severity of some of the health problems really creates us a perfect storm. And I was just saying that I am not a pessimist, not at all. I'm actually more an optimist, but I think we've got to take a really realistic, hard planning look at the current situation. And there isn't any economy really without health. So I think early intervention from now on is going to be my main theme. I'll just very briefly give you an overview of what COVID and long COVID are, because I think this is important and the messages haven't been getting through. So long COVID is COVID. That's what I want you to remember. It causes exactly the same problems as when you first get it, but they just carry on for longer. So the problems that you've heard about on the news in the acute or the first situations continue in those with long COVID. And a lot of these effects are predictable effects of virus, but COVID has an added nasty extra, and that is the tendency for people to form really awful blood clots. So it actually causes a thrombotic vasculitis. So it causes an infection and an inflammation of blood vessels, which causes clots. So this means we have blood vessels everywhere, that we get problems in every single part of the body. And the main problems are actually cardiovascular and neurological, rather than the respiratory that you might have heard about in the news. So we're dealing with some very serious problems, and the data is showing that even very young people, the other day I heard of a 24-year-old girl who just had a stroke 3 weeks following COVID. So there's some very serious complications happening. Now, work-wise, I think one of the things that's going to have the biggest impact now and in the long term is some of the neurocognitive effects. We don't fully know what's causing all these, and it's probably a combination of factors, but it happened after the 1918 flu epidemic. So it's pretty common for people with long COVID to have some cognitive effects, and often these get better, but we obviously don't know the future, and some people's situations are ongoing. Subtle cognitive difficulties may only become apparent when people come back to work, either after a period of absence or if they take on something more complex. So I think as employers, that's something to be very aware of. And one of the other effects that's very common is that the autonomic nervous system gets affected by the virus. And some of the effects of that can be very disabling in terms of people's function at work, for instance, their ability to stand or be upright for a long period of time. So what do we need to do? What are the solutions? I think we have two groups of employees or workers that are affected. One is those that have been often ill for a very long time, and they're going to need intensive support and coordinated support through all of us, employers, doctors, occupational health, human resources, and wider. And then we've got people who are more newly infected, but still may have had quite prolonged absence. And I think this is where we really have to get in early and do everything that we can. Now, medically speaking, and I'm right in the thick of all the research that's going on, there is good data, and also very good data from rehabilitation programs, such as the military, the UK military have a fantastic rehabilitation program that they laid out more than 2 years ago. And it's about getting in there early enough. First of all, with advice to rest adequately in the first period, to be given the right sort of advice on self-management and pacing at home. These are really key things that patients say help. And then they actually need some medical treatments, even on a very small scale, for symptoms. And they may need, if they carry on past the 4 weeks, certain investigations. The earlier these can be implemented, the better. So it's all about timing. So one thing I would like employers to consider is what we do about getting healthcare for our workers. It's not been unheard of in the past to assist either through insurance programs or in some cases funding a specialist appointment. Because a huge roadblock here is the delays in the health service, and some big employers have said this to me already. That is the roadblock. We would like to help our employees back, but we're absolutely stuck because they're waiting for appointments. So it would be incredibly helpful to take the right medical advice from occupational health staff who will be able to say to you, right, this person needs this, this, or this. Please, could you see if there's any way of organising that or funding that, because that may well be very, very much cheaper than having somebody off for even a week or two. I mean, the cost of somebody's absence for 1 week is high enough. So those would be 2 things I would really like you to think about: the early intervention, getting the right healthcare advice, using occupational health to advise you how things can be accessed. And my third point, as alluded to already, is to think about embedding occupational health services in your business strategies. I used to work for the University of Manchester, and we taught most of the postgraduates in occupational medicine in the UK. And when sitting their exams, we used to set them these situational judgment questions. What would you do if, and then what would be your first approach? Now, the right first answer, if you were going to try and introduce something different or a specific healthcare program, is to engage, first of all, with senior management. So occupational health would like to be able to have those discussions and say, look, this is the big picture. This is what we may be able to advise and help with. One parallel, just to finish with, is that occupational health services already provide health services, if you like. We do health surveillance services, and we do rehabilitation services, and we procure and help set those things up. So we can talk to you about that kind of thing, and I think hopefully drive this in a coherent way from the top. I think really those are the things I would like to say. My final, slightly unrelated to that, but it is to do with preventing more cases, is can we think about public health in the office? Cases are now raging again. People are getting reinfected. So I would strongly advise, open windows, masks, and, air filtration if possible in your workplaces. So there we go. I think those are my main points. I'd like to hand over to Neil now, and we will take questions afterwards.
Thank you very much indeed, Claire. That was great. I'm going to share my screen and do a bit of a slide thing, but I will aim not to be too slidey, because I appreciate death by PowerPoint can be a enable, just doing me a bit pesky. So you've already kind of heard who I am, so I'm not going to introduce myself too much. For any of you who do Twitter, that's Twitter handle. We try and pump out our academic papers on there. And I guess just to kind of sort of let you know, is my real interest, which stemmed from my time when I was in the military, was how do you help all individuals who are in organisations who are doing challenging work? How do you help them remain resilient in the face of significant adversity? And as well as being a trustee with SOM and also with the Faculty of Occupational Medicine, I am leading on the World Psychiatric Association position statement on mental health at work, because I'm really interested in this interplay between mental health and the workplace. Here's just some small amount of information. I'm not going to go into it in detail, but the key point here is very much trying to make the point that mental health and people's ability to work are very much intertwined. And basically, if you want to have an effective organisation, then if you don't pay attention to mental health, then you're likely to have difficulties, both from a duty of care, so legal point of view, but also from a reputational point of view, and also from an economic point of view, because you won't be able to produce your functional outputs as well as you want to. And you will know already that, as well as people not being at work, there actually is a huge amount of impact from presenteeism, from people being at work when they're unwell. And that's particularly important if you happen to be in a safety critical role. And I've got pictures here of pilots and military, but healthcare workers are a great example over the past couple of years. And when healthcare workers have a poor mental health, if they're not delivering high quality care, that also can have some very significant impacts. And I think from a business point of view, if you've got people making big decisions or entering big negotiations and their mind's not on the job, again, you're highly unlikely to get a good functional output for whatever it is your business does. Worth saying that one of the problems with mental health, as you know, is about this idea about stigma, that many people with mental health problems don't present until late on. This is some data from our military studies looking at troops from different countries, the USA, UK, Australia, and Canada. And what we find here is the biggest reasons that prevent people from seeking help are they worry about what their colleagues and what their supervisors would think about them. So there are lots of reasons why people don't get help, but very much in the workplace, they are worried about people around them and what they might think of them if they did get help. When it comes to this, what we know is that what makes a huge amount of difference in the workplace is having a supervisor. And by this, I mean the person who's immediately your line manager, so the team leader, the sort of group director, so, who's looking after the team. We know that having good supervisory level leadership makes a huge amount of difference. And the immediate line manager's ability to speak about mental health and to inculcate their attitudes towards mental health on the team makes a massive difference. This is data from British troops in Afghanistan in 2010. Just less than 3% of those troops probably had post-traumatic stress disorder. It's not surprising, they're in a war zone. But these are troops who viewed their immediate supervisor as being supportive, and these are troops who viewed their immediate supervisor as not being supportive. There is a 10-fold difference in the rates of probable PTSD there. This is another study which looked at US troops. This is just last year looking. And basically what they found there is that if you had a supervisor who had what they called health promoting leadership, it led to a substantial decrease in all the troops' mental health problems. So having a leader who took an active interest in your health, mental and physical health, makes a really substantial difference to your mental health status. So what do we do about that? Well, this is a really good study done in Australia, where basically they trained up fire station managers in New South Wales in Australia. Now, fire station managers in New South Wales are probably not the most psychologically minded individuals you might meet, but they gave them a short amount of training about how to speak to their staff about mental health matters. They did what's called a randomized controlled trial, so it's a high quality trial, and they found that they were trying to increase the supervisor's confidence to speak with staff about mental health. And they found here that they published this in a UK journal, which is why it's in pounds and not dollars. They found that for every pound invested in that training, it saved £10 in sickness absence over the following 6 months. So again, a short intervention aimed at supervisors seems to make a substantial difference to the workforce's health and ability to work. And there's kind of two ways that you can get people to try and supervisors to try and help their staff. And the two main ways that can happen to do this are that I'm going to talk about are something called React and PIES, and I'll just describe them in just a second. So the React training was based upon what we found out from that data in Australia, that we needed to train up supervisors how to have these psychologically savvy conversations. But when the pandemic struck, there was obviously very little time and no one had any ability to give people half days and days off. And so we designed a very short package, which lasted 1 hour. And although we initially delivered it face-to-face, eventually we ended up delivering this on Zoom, doing breakout rooms and the like. And what the React package was to try and help supervisors who had staff doing challenging work to spot, first of all, they might have a problem. So these were kind of the warning signs that supervisors might have that someone was not performing well, or there might be something wrong. So this is when you might have one of these supervisory chats, these React chats. And what we did is to train people over this hour how to use the React approach. And this is what the React acronym stands for. So, how does someone recognize who's got a problem? How do they engage them? How do they actively listen? How do they check that the person's not got any risks? And by this, we mean risks to themselves, but also risks to the organization. So in a healthcare sense, you don't want people making mistakes. In a business sense, you don't want people making poor business decisions or poor management decisions, which will affect other people. And then to talk to them about specific actions. So rather than say, gosh, that sounds terrible, we wanted people to come up with a problem-solving plan. And I won't go through all of these and sort of tell you how to do it, because that's the React training. But as an example, is you're in the workplace, you're a supervisor, you spot that someone might have a difficulty, and you're kind of wondering, well, how do I start off this conversation? How do I open the door? And so one of the simple techniques you can say is, well, if you've spotted someone in a healthcare setting, who's spending a lot of time with a piece of equipment and they're not using it properly, and they're not sure what they're doing, and that's out of character for them, rather than just say, how you doing? Because people then come back and just say, I'm fine. You can say, look, I'm really sorry, I hope you don't mind me saying, but I've noticed that you are spending a lot of time on this piece of equipment. So to use what you've seen, what's causing you concern, as a lever into talking to them about their well-being. And so the React course has lots of these little tips to try and help people open the door to having a good management type conversation. It also checks risk, and then hopefully leads to some specific actions that can be done. And importantly, these are confidential. So it's really important as a supervisor that you keep that confidence and trust. Otherwise, these sort of things don't work. We did a small study, which we published in Occupational Medicine, which is a quick journal. And basically, before these healthcare supervisors did this course, over half of them didn't feel confident to have these psychologically savvy conversations. 1 month after the course, nearly 85% did. So if you've got people in supervisory positions at the most junior level of supervisor, you really want to make sure you upskill them to be able to have these psychologically savvy conversations. That's really important. Another thing that supervisors could do, just talking about the supervisors again, is to use these things called the PIES principles. So again, if you've got supervisors and they spot someone's having difficulty, and the question is, what do you do about it? How do you manage that? And actually what you shouldn't be doing is say, oh, go and speak to the employee assistance program, or well, go home, go and speak to your GP, come back when you're ready. There is sometimes this feeling that what you should do is just kind of push someone away to go and get help. Actually, that's really harmful. Instead, what you should be doing is to keep people within the workplace and to support them more, and to adapt their work a little bit so that they are in slightly a less pressured role. Back at the time of the First World War, when the PIES principles were first used, the phrase was, keep them within the sound of our own guns. Now, hopefully there's not very many guns. I don't know what you do for your industry, but we want to keep them within the workplace where they have support, which we know makes a huge difference, and where they don't worry that other people are talking about them, and they don't lose their self-confidence. Immediacy says that if you've got someone who's got a mental health difficulty, we know that unfortunately many people who have mental health problems, because of stigma, don't come and get help early on. And normally the first time they seek help is when something goes wrong. And that can be because, maybe they've made a huge mistake at work, maybe they've got involved in some criminal activity like drink driving, which is way out of character. Maybe they split up from a partner because of their unreasonable behavior, because they're stressed. But we don't want to wait till people get to the point of crisis before they seek help, before they hit the buffers. We want to try and get them upstream. So immediacy says that if you can see that things aren't right in the workplace as a supervisor, you want to be having these proactive discussions early on, because nip things in the bud rather than wait until people enter crisis. Expectancy also says that if you've got people who are in situations where they're highly distressed, well, guess what? Then in most cases, that distress doesn't actually go on to become illness. There is sometimes a tendency for people to be overly worried. If you've just split up from a partner and you are very upset, that is to be expected. That is not necessarily a sign of illness. Now, you don't want that person going out and driving their car a long distance because their mind's not going to be on it, but you do want to support them. And the expectation is that actually we're going to look after you here in the workplace. And if we look after you properly, probably things will get better over time. And mostly the evidence is that whenever anyone has a shock or they get involved in a difficult situation, that mostly distress tends to dissipate over a period of a few days or a few weeks. So the expectancy there is actually, we can help you, we can sort this out. The other bit to expectancy is that if it can't sort it out, if it doesn't help, then we need to make sure that you go to speak to someone who's got a professional qualification. We don't just want to leave you languishing. And then the last thing is simplicity. If you've got someone who's extremely anxious about an upcoming trip or about a piece of equipment or about a skill that they've just learned and they're not sure about, that anxiety doesn't mean they need a mental health intervention. What it means is they need good support and management and mentorship to try and help them use the piece of equipment to understand what the task is or to practice their skill. So we shouldn't overinterpret distress as being an indicator that people need care, so to speak. And simple things make a huge difference. How many times have you gone to bed worrying about lots and lots of things? You wake up in the morning, have a good night's sleep, and you think, do you know what? I can't really remember what it was I worried about. So these PIES principles describe the actions that supervisors can use to keep people functional at work. And this is a study done by the Israeli army some years ago. It was published in the American Journal of Psychiatry in 2005, and it looked at a 20-year follow-up study of troops who were involved in the First Lebanon War. Now, in that First Lebanon War, they had lots of stress casualties, lots of people who appeared to have symptoms that you might want to say, well, just go away. But actually what they did is they managed them, and they found the more of the PIES principles put in place when someone had one of these stress reactions, the better their outcome was 20 years later on. So PIES isn't just about getting supervisors to manage people well, just to keep them at work, although that is nice. It's about managing people well because actually that's better for their longer term outcome. And so the conclusion really of this bit of the talk, because hopefully we'll get into a discussion piece, is that actually the way that you upskill your teams to have supervisors who are capable of having really useful, supportive conversations with their staff makes a huge difference. If you can nip things in the bud rather than waiting for people to be ill, that is going to make a huge difference to the individual, but also on your ability to solve their problems. What unfortunately happens is that when people wait until they've had to enter a crisis, they often get themselves into a spiral where they've not been functioning well at work, so they haven't been getting good performance. They may have broken up from relationships that are important to them. They may have lost their self-esteem. If you can nip that in the bud, if you can hit it upstream, you can prevent a lot of these problems from manifesting. That having these conversations with staff starts with the supervisor, and they need to be able to identify individuals, speak to them, and support team members. The PIES principles gives you a broad outline of the sorts of things that make a difference. But of course, where distress doesn't resolve, then that's the time that you want to be using your professional resources like your occupational health department, like if you have an employee assistance program, you might be looking at that, or making a referral to a mental health professional, whatever it might be. You don't want to leave someone who's languishing, who clearly isn't getting better, even with your support. So there's lots I could say about mental health in the workplace, but what I've been trying to get across in this particular is that by investing into your supervisors and making sure that at the most junior level in your organization, you have the capability to manage your team members well, that will make a really positive difference to the mental health of the workplace. And even if you can't prevent people from necessarily becoming unwell, what you'll hopefully do is to make sure they get pulled forward and get into professional care early on, which is likely not just to be good for them and for your organization, but is also likely to mean that they remain loyal to you. And you know, we all need staff, particularly at this time where it's a bit of a buyer's market for an employee. So that's me, and I'll happily see if I can stop sharing.
Okay, I think this is where I come in now, Catherine, isn't it, to moderate any questions. I've got a couple of questions in the chat, and as before I do, I should introduce myself as Nick Powell, Chief Exec of the Society of Occupational Medicine. And thank you, Neil, for a great presentation on mental health. It was really good, and Claire as well in terms of long COVID. I know we've got some experts here from Leslie and also people from COPA who we're doing this joint awareness with too, so welcome everyone. The first question, that's with really long COVID ones, or maybe Neil can come in on the second one, is what's the impact of new variants on long COVID? It's kind of a tricky question. I don't know if you can answer that, Claire.
Yeah, I think I saw that about BA4 and BA5. I think it's too early to say, but what I've said with other variants is that we should expect it. There's nothing about any of the variants so far that seems to show different rates of long COVID. I think a lot of this is about people receiving the right advice and the right treatment at the beginning of whatever variant they have. But I think, I don't even know which variant we're on, but I think all the evidence is that the current one is far more infectious and pretty severe as compared to some of the others. So what we do know is that reinfections make things worse in most people. So getting reinfected is a very bad thing. And the risk of long COVID, and I can't quite figures because I just haven't quite got them to my head, is significantly increased with each reinfection.
Yeah.
So we know that.
So Mike, you've got a quick question here, Mike King, about noticing persons with a history of stress, anxiety, and depression seems to be suffering from long COVID. Is this borne out in other OH and business? I'd be interested to know your view, Neil, as well as Claire, and maybe Leslie, that one's coming too.
So I think that the thing to think about here on this thing is about, you're saying people who already have a mental health history may also be suffering with long COVID. And of course, having a mental health history doesn't prevent you from getting long COVID, or it doesn't. But what you can be pretty sure of is that people who are more vulnerable will have the potential to find any particular strong stressor, whatever it is, including catching COVID and just suffering with that by itself, as potentially reigniting their vulnerability that might have been there before. So in terms of the biology and the sort of mental health aspects of what causes long COVID, we could spend a long time talking about that, and I think the question it still needs to be answered. But there's no doubt that that if you have a chronic illness, whether that's long COVID or whether you have any other chronic illness, that there's a deal with the illness side, obviously, which is really important, but there's also dealing with the psychological impacts of that. So for example, we know if you have cancer, for instance, clearly you don't have cognitive behavioral therapy for cancer. That would be completely stupid. But that whilst you have your treatment for your cancer, you want to try and manage the depressive symptoms that you may understandably expect, because that not only improves your quality of life, but actually seems to improve your ability to comply with whatever the treatment requirements are for your chronic condition. And I think in that sense, long COVID's no different. So I think what we have to remember is that people who have anxiety and depression, once you've had one episode, you are more likely to have more episodes. Actually, interestingly there, because I've been doing a review on this for some other reasons, is that there's often this a debate about whether your vulnerability to have more mental health problems is as a result of a scar caused by that first episode of depression, or whether it's a result of vulnerability factors that will probably be there beforehand. And on balance, the evidence seems to point out is that people who are likely to have recurrent depression are more likely to have pre-existing vulnerabilities in the first place, which basically means that actually if we can give them the right treatment, psychological treatment, then hopefully we can improve their coping skills and their ability to cope with whatever sort of stressor comes at them, including long COVID.
Yeah.
I just wanted to kind of de-clinical and de-medicalize the conversation. I'm aware that sort of people from IOD might think, God, these people are saying things I don't quite understand, although I'm getting it and they're experts. And I suppose from our perspective from occupational health, very keen not to medicalize, certainly on sort of mental health issues and occupational health. It's a very kind of pragmatic approach. Medicalizing has got its own issues as much as, as a non-clinician, I need to be careful what I say, but certainly say with long COVID, it's important that certainly people's sort of symptoms are looked at carefully sort of by medically qualified staff, and sadly that's not particularly available. But just on the mental health side, I just wanted to really come back to you, Neil, just in terms of I suppose doubling down on the messages to kind of IOD members, that not about medicalising mental health as much as possible. It's about good culture, leadership, and management of people who are suffering these stresses, but not about medicalising. So I don't know if you'll articulate that again, just to reassure business people on this call that it's what's important is how business people manage their staff, really, isn't it?
Yeah. So I think if you look about mental health in a broad sense, the best thing you can do obviously is prevent people from becoming mentally unwell in the first place. So that comes down to having good peer support, great supervisors, the right attitudes, the right Maslow's bit where, you have reasonable car parking and you don't ask people to sit on a chair that's uncomfortable, or you pay them reasonably, all those things about being a good employer, whatever good work is. So once you've got those in place, and you've got a good team and good attitudes, so you minimize the likelihood that your staff members will experience mental health because of their work. Of course, people get affected by stuff in their home life and, a car crash and getting assaulted there's lots of things that affect people's mental health, not just what happens in the workplace. It's important to remember that. So once you've taken that, inevitably people will become distressed, even if you're the best employer with great work. And therefore what you want is the ability to detect that early on and intervene with simple interventions, more support, changing people's roles, and you can do that in the workplace. And then if you do that, you'll minimize the chance that actually that distress will go on and become illness. But again, even with the best support in the world, some people will become unwell. And when that happens, you want to make sure that you spot it early and get them to a professional so that the treatment that they might have is as non-complex as it can be. So that's the prevent, detect early, and then treat where you need to.
I'm probably going to put Catherine on. I'd like to hear from IOD members, actually, just from what you've heard on this conversation, did it make sense, and is it useful for IOD members to kind of get a sense? I'd hope it is that these are big issues: mental health, work stress at work, long COVID. People don't necessarily understand it, and you've got some experts here trying to simplify it and say what it means and how to deal with it. So, and then Catherine, from your perspective, and talking to members day in, day out, hopefully these are the messages that will be helpful, and then pick up later, I hope, as well as the recording.
Absolutely, Nick. I actually dropped in the chat box that I've never been more grateful to be recording a session. One of the things our members constantly ask us for, irrespective of kind of subject content, is practical advice and support. And both Claire and Neil were just full in their presentations of practical advice and support. And notice Leslie in particular in the chat box also offering lots and lots of practical advice. So what my intention would be actually after this session is to kind of download the links that have been shared in the chat box and share a copy of this recording as well. But I think you're absolutely right. Claire and I were talking before the session started. This is only going to become a more pertinent problem, particularly when you think about the external factors at play at the moment in terms of the cost of living crisis, the war in Ukraine, the general uncertainty around the economy in the UK at the moment. People are really quite scared and have been scared since March 2020. There hasn't really been a let up. In fact, when you think about, March 2020, we had one thing to worry about, and currently we've got about half a dozen, huge factors at play. And I mean, I know our members are reporting concerns along the lines of, kind of future sustainability. How do they do this? How do they attract the right kind of talent and skills into their organizations, because we're now competing with an international market? Hybrid and home working is a huge thing. So can we, are we able to pay wages enough to attract the right talent? That's a real issue for us at the moment. We're also seeing, and it came up in the chat box, but burnout is a real concern. Particularly in those SMEs and sole traders who haven't had the chance to, take their foot off the gas. They've been putting everything that they've got into keeping their organizations going, having a reason to open the doors for tomorrow. And, there has been no respite and no let up whatsoever in the past 2.5 years. So I think everything that's been said tonight chimes hugely with the experience in Scotland. And I know that, we've got IOD colleagues from across the UK with us tonight as well, which is fantastic. And I certainly intend on sharing the recording from this session as far and wide as possible with my colleagues internally and the wider membership.
Good. I mean, I suppose one of the message we did a YouGov survey for the Awareness Week, looking at what people think about workplace health, and I suppose we're concerned that obviously that there was the stress and kind of everything's been difficult since March 2020 and going forward, and people want to kind of retain the right stuff. That actually businesses are perhaps going slightly scattergun, pick and mixing. What can we do to help the workforce? You've got to keep these people happy. You can't necessarily pay them more, but what can you do to kind of keep them sort of feeling supported and sort of healthy and happy at work? And I suppose this is where just sort of a plug. I mean, but it's not kind of shameless. Actually, the occupational health can really provide sensible advice. It's not about sort of going for the nearest mental health app or saying, okay, we're going to go and sort of buy a sandpit and everyone can play in that and feel better. Those kind of things don't make a difference. You've got to look at where your workforce is at, what are the big issues, and then approach it in a professional way. And I suppose that's where occupational health can come in and say, look, both in terms of prevention and sort of dealing with a sort of health issue from long COVID to mental health, you can get professional advice. It means you don't have a legal case against you. You're doing the right sort of moral thing, and actually we know the return on investment on occupational health is very strong. I'm going to bring in Leslie McNiven, who's I know has done some great stuff in the chat and has brought a lot of good sort of focus on long COVID and employment with your group, Leslie. So over to you. It's great being in Scotland, and I know you've done some great work advocating around sort of the long COVID issues and employment in Scotland.
Thank you, Nick. Yes, I'm in Edinburgh, just up the road from where you were planning to meet. So I just wanted to build on a couple of the points that have been made and echo them and really reinforce them. And I was really interested to hear Catherine's observations about what employers are struggling with at the moment. I'm an HR consultant, and I've been working with the CIPD, and I think there's a really strong role for people like the Institute of Directors to show some leadership in this. And so we're really finding it useful to work with people like the CIPD and the TUC, and obviously the Society of Occupational Medicine. Nick's been brilliant at involving us in all sorts of different ways to support people. So please do let's keep in touch, Catherine, after this. I'll pop some more links in. But the Atlantic had an article out today saying, and I sent it to my family actually, because we've got colds at the moment and we keep testing, a negative COVID test has never been so meaningless. The Omicron variants that we're dealing with now are coming up positive much later, it would appear. And so Claire's earlier point about workplace health, really being careful and getting people to stay at home, even if it's a cold. Nobody wants a cold at this point because we're all on borrowed time in terms of we're all at the end of our rope. So there is something that we observe as patients. So I was a co-founding member of Long COVID Support, which is a charity with 53,500 members. I co-founded Long COVID Scotland to do campaigning and lobbying in Scotland in August 2020. And with Claire and 3 others, we run a consultancy called Long COVID Work, and we're trying to kind of help people join up the different dots and take a multidisciplinary approach. And, you know, I would echo what Claire was saying about prevention is definitely better than cure. But the perspective from patients is there's a huge constructed narrative coming out to business to say we all need to be back at work in person, we all need to be going back to normal. And this feels like a risky strategy to, again, talk about managing risk. And so we are trying to not sound like Cassandra, but we are trying to say people who've had long COVID are very, very risk aware and risk averse, and we can see and have experienced what it's like if you get this thing, and we would always avoid getting it again. And so we are trying to not scare the horses, but to try and preach a cautious, precautionary approach, and to suggest to people that, you know, that the pandemic isn't over much as we want it to be, and there are probably going to be challenges ahead. So this idea that we're keeping going, and then at some point things will stop, I think is wishful thinking. So I think we do need to find practical ways of trying to manage this as an ongoing issue. I mean, I did a lot of leadership development for many years in large organizations. There's a lot of change management in there. We don't manage change projects anymore. Change is continuous. So it's what's really important is supporting leadership teams to see this as a strategic issue, to look at what the challenges are for their business. And one of my most fun roles was as a talent management lead in a FTSE 100 company, and recruiting and retaining talent was huge back then. And as has been observed, it's massive now in a shrinking market. We're losing so many people.
We know that. I was talking to Neil before this webinar about data from Institute of Appointment Studies of people out of work due to health has increased considerably. You might have noticed that I'm not Jackie Bailey, the member of Scottish Parliament, who's on parliamentary business, and another MSP also couldn't make it. But I'm hopefully doing my job okay from the side of occupational medicine. But I just want to also do a sort of shout out. I don't know whether people from COPA want to say hello. We've got this awareness week with COPA who can explain who they are. But I think one thing, if you're on this call and thinking, occupational health sounds quite good to me, do look at some website where you can find the occupational health provider, or look on the COPA website. Carol Mook and the MSP is now here, so welcome. So maybe we can bring her in. But hi, Carol. I don't know if you, when you joined, Carol, but clearly we've been covering sort of mental health at work, long COVID issues, how occupational health can help, and I was just doing a segue to either Alan or Anna to kind of introduce themselves from COPA, and then perhaps we can come to you just for any sort of final thoughts and reflections. So Alan or Anna, do you want to say hi from COPA?
Yes, good evening all. So Alan Ballard, I'm the chair of COPA. I've worked in occupational health for 17 years and represent the commercial organisations across the UK to deliver health and wellbeing services across the piece, advice and commercial support to our members, including legal advice and various other initiatives such as this one today. So it's great to be here, and thank you everyone for joining. And Claire and Neil, thank you so much for your presentations. They're absolutely fascinating. So I'm glad this is being recorded. So Anna, over to you.
Yeah, hi, I'm Anna Jones. I'm the association manager. So I've been working closely with Nick on OH Awareness Week for this year. I'm glad to see a couple of our members here. So hi to you too, because I've not actually seen you before, but it's nice to actually see you. I think, things like today are brilliant. I think occupational health, we need to work together to educate people on long COVID, mental health, all of those issues that are in the workplace. And as has been said by everybody tonight, it's about talent retention, presenteeism, health at work, and that's we are the people in the business that do that. So we need to, keep educating people, keep awareness of OH, and work together. So I would be very interested to work with CIPD and the Institute of Directors and do some training programs about OH and how we can help each other out, really. It needs to be more of a director strategy and collaboration with the big corporates, I think, in OH, and we need to invest in OH and move it forward that way, I think. So
Yeah.
yes, thank you
Yeah,
very much.
thanks,
Carol.
So just before I hand over to Carol, it's great you could be here, and Carol's the Shadow Minister for Mental Wellbeing and Women's Health of the Scottish Labour Party. Just in terms of our kind of policy and advocacy asks, which I'm sure you'd be interested in, to get some ammo in terms of your role. I think the first thing we're calling for is universal access to occupational health. We know its coverage is less than half the population got access to occupational health. We did have a meeting last year with Sir Keir Starmer, and it could be quite a nice little manifesto pledge, obviously just a one-liner, but actually, for the Labour Party, supporting workers through occupational health, I think would give that reassurance, and feed into the kind of values of the Labour Party. So we did do a costing for that, which is around about 280 million to cover all employees. So I can send you that, Carol, afterwards, and certainly Claire Mattis, who's our policy advisor, can do that. I think the second one is that support for kind of key care people working in the care sector within the NHS, the care sector, to have that occupational health support. They've been through a huge amount of stress and strains, and it will help with that sort of retention. And there's a challenge for the sort of health service in Scotland. I think in terms of long COVID, looking at England, they've got these long COVID clinics with some kind of return to work aspect, and I know there's been some announcements in Scotland for long COVID, and we'd like to see more. So I think pressure in that area in terms of support for return to work and just general support for people with long COVID is important. And I might just add a sort of personal one, considering your brief in terms of women's health, is we were pleased to see the government actually announce some money for the voluntary sector to do kind of reproductive sexual health workplace support, things like the menopause, etc. And this is a really big issue. Having menopause, women's health, reproductive sexual health is a kind of workplace health issue, and people and employers need to understand that and have the policies and support in place. Again, something occupational health can help with. So, I don't know if that's a useful kind of brief from me in terms of our policy ask. I wonder whether you've got any kind of response either to that or what you've heard so far.
Yeah, first of all, obviously, I just have to really apologise to the Parliament. It goes into recess next week, and so the number of things that are being added in, we're being told will be in, so sort of 7, 8 o'clock right through, which it's not a problem. Our job compared to others is easy. It's just the timing when you've organised things. So I'm hoping that I might, if it's recorded, that I might be able to get permission to have a listen, because it is a really important issue. Obviously, my brief in Scottish Labour, but people have mentioned in the chat just how much work Jackie Bailey is putting into long COVID, and we're very, very convinced in the Scottish Labour Party that we really need to push the Scottish Government on this one, because they have been slow, and I'm a relatively new MSP. I've just been here for a year, but if I was to be critical of the Parliament does lots of reports, but action is much harder to get out of the Scottish Parliament at this particular time. I'm trying to not sort of be focusing on party. I'm trying to just say the Parliament needs to do more. It definitely does. And opposition have a role in that, and we certainly will continue to do that. Can I just say the 3 points that you gave me are absolutely excellent. 4 points, are absolutely excellent, and I definitely will commit to follow that up. In a previous life, I worked in the health service, and I did lots of trade union work. And in actual fact, one of the early committees that I got was occupational health. So it's interesting when you're younger and you get these things, it stays with you your whole career. And so I'm very, very interested in that notion that all workers, because again, I'm a trade unionist, so all workers should have access to that. So you're absolutely right to push us on that one, and I will endeavour to take that back to the health team, but also individually as an MSP, have a wee think about what I can do on that. And women's health, absolutely. Women's health, I was given, as you get given when you get elected, you're sort of given these things. And I did not realise just how much work is needed to make sure that we get these policies right for women. When you look at some of the statistics, around, the poorer outcomes for women, the less amount of money that goes into things like menopause, that sort of thing. Some of the work that Monica Lennon did on period poverty and people's, the right of women to have access to period products in the workplace is immense. So I have actually really enjoyed the brief. And have got quite a number of points that really over the next 4 years when I'm in, I want to follow up, and the sort of work and menopause policies and how we make sure they're looked at properly is high up on my list. So I really appreciate that. So no, I will go over, if there's anything individual that people want to send to me to follow up, please do. I really appreciate people. In opposition, the key thing is that sometimes we know what we want to say, but it's the professionals like yourself that can just get those questions right for us so that we actually get the answers. Whereas sometimes we can't be experts in everything, so we're very broad in the questions that we ask. Some specific questions, if you need them asked. I always say to people, I quite like being awkward. That's the only benefit of being in opposition, because of course we want to be empowered so that we change people's lives. But in opposition, you get to be a bit cheeky, which is quite nice sometimes. So please, if you need somebody to be cheeky, send it on.
Thank you, Carol. I mean, just we're happy to sort of put parliamentary questions through to you, and we'll certainly think about that. And something that we're doing at the moment actually is a freedom of information request to NHS trusts and councils in terms of people who've been made redundant due to long COVID, and particularly in the NHS. Obviously, there's a kind of moral it just doesn't feel right if you got COVID because you're carrying people with COVID in your work and then you get sacked. That doesn't feel right at all. And it's interesting the data is just coming in, and certainly we'll share that with you. We are out of time actually, so I'm sure we could talk more, but this is our time allotted. Thank you, Carol, for your comments. We are here to work with you on all the agendas you are from mental health to women's health. Thank you, Claire and Leslie, on the long COVID side. We will continue to champion, good occupational health and good care for people with long COVID. Thank you, Neil. It's always fantastic to hear such common sense and useful advice in terms of mental health. And finally, thanks to IOD for hosting us today, Catherine, and we'll stay in touch, obviously. But I might hand over to you, Catherine, for final sort of wash up and say I hope you enjoyed a lovely evening.
Thank you very much, Nick. Yeah, I mean, just to echo the thanks that you've already extended, and to thank the IOD members for giving up their evenings to take part in what's been a really insightful discussion, and one that I think is, incredibly important and needs to have more, have a louder voice going forward. And I certainly am quite happy to support that from an IOD perspective. So Anna, absolutely, let's have a follow-up conversation. Likewise, Nick, it'd be great to kind of keep in touch and just look how we can kind of support this agenda to get the voice and kind of the amplification it needs. And Carol, we could have a conversation offline as well about the work that you're looking to do to support women in particular, because that's a particular area of interest of the IOD, particularly in Scotland. So thank you all very much for giving up your time this evening. I hope you have enjoyed the session as much as I have, and I will circulate a copy of all of the links that have been shared, as well as a recording from the session as well. I hope you all have time now to go and enjoy what's left of the sunshine from tonight. Thank you, everybody.
Thank you. Thank you.
Bye. Thanks. Bye.
Thank you, Nick.